In this video, you will learn how to perform a number of critical skills you will use as a nurse assistant. To provide quality care, you will learn to focus on two important themes. The first is to be aware of your environment, your residents, and your own reactions. The second theme is to always make an effort to understand those whom you care for. When you understand your residents, you can better tend to their needs, thus gaining their trust, putting them at ease, and making them more comfortable. Following these two themes allows you to give the very best care and bring out the best in both your residents and yourself. You feel good about the work you are doing, and they will enjoy a better quality of life. For each of the skills in this video, there are common preparation and closing steps that you must learn. The acronym Be Aware will help you remember each of the necessary preparation steps and the order in which you must perform them. B. Before giving care, check the plan. It is important to know the specifics about every resident. No two residents are alike, and each has unique aspects for their care. You should plan for these differences in your daily routines. E. Enter by knocking and introduce yourself. It is important for you to do this every time you enter a resident's room. Residents sometimes have memory impairments and forget who you are, so it's important to introduce yourself and show respect for their privacy, even with tasks done regularly. A. Assemble all equipment and ask for help if needed. Being prepared is a very important part of your daily routine. Managing your time well requires that you plan ahead for each task. After checking the care plan, make sure that any equipment or special devices that you may need are available. And before getting started, ask a coworker for help if the procedure requires it. Being prepared also helps residents be more comfortable and confident in you as a caregiver. W. Wash your hands before giving any resident care. One of the most important things you can do as a nursing assistant is maintain excellent infection control practices. Always wash your hands before giving care to any resident, after any contact with dirty items or surfaces, before eating, after toileting, and after caring for any resident. Your hand washing techniques used between caring for different residents will play a huge role in their overall health by preventing the spread of infections. The video for the hand washing skill will show you the details to practice with all of your skills. A. Ask the resident for any personal preferences during the procedure. While you are providing care, the resident may voice concerns or preferences about how they would like things done. You must acknowledge their preferences and make adjustments as you can. For example, residents may prefer to use their own products, lotions, and soap when bathing. Always try to make the resident as comfortable as possible with the procedure. Make every effort to accommodate their preferences. R. Respect the resident's privacy by closing the door and pulling the curtain. Ask visitors to step out and lower the blinds if needed. Prevent the resident from being exposed. Almost everyone greatly values privacy, and you need to remember this when caring for others. Dignity is one of the primary rights that we need to protect for all the residents we care for. E. Explain the procedure as you go and answer any questions. Residents want to know what to expect, and it helps when you give specific information during the procedure. Whether it is bathing or assisting with a meal, most residents like to know what will happen next. It gives them time to prepare and allows them to process the steps as they go. It lets them voice any questions or preferences during the procedure. Explaining things and answering residents' questions also decreases their anxiety. The acronym UNDERSTAND will be used as the reminder for your closing tasks. How you end a procedure is just as important as how you perform it. This is the last chance for you to assure the resident that you care for them and leave a positive and comforting impression. Understanding the closing process helps ensure the resident's safety and comfort, as well as their confidence in your ability to care for them. The memory aid understand, is used in this video and the textbook to help you remember and integrate the art of understanding into your practice as a nurse assistant. U. Understand the resident's concerns as you complete the procedure. They may have questions or preferences. It is important for you to listen attentively and respond to their concerns appropriately. N. Note the resident's reactions. Often you will notice that residents may grimace during the procedure or respond in ways that could indicate the need for additional assessment by the nurse. You need to observe their reactions so that you can report and document them for future reference and follow-up. D. Determine the resident's preferred position for comfort. It is important as you complete any procedure that you ensure the resident is comfortable not only during the process, but before you leave. Be sure to consider their need for supportive items such as extra pillows, additional covers, and positioning to provide the maximum level of comfort. E. Examine the environment for safety concerns. Make sure that all paths are clear of items that could cause a fall. Make sure that the bed is in a low position and that items that the resident will need are within their reach, such as water and food. R. Remove your gloves and dirty items and dispose of them properly. Be sure to follow infection control measures to prevent the spread of illness to residents. Following current infection control guidelines is the first line of defense for the residents to maintain good health. S. Secure the call light and any other needed items within reach of the resident. This is a critical step in the care of each resident. Being able to reach someone when they need additional assistance goes a long way in making residents feel secure. T. Talk to the resident and let them know that you will be leaving soon. It is important to update your resident at each step and to let them know when you will be leaving. This is important for allowing the resident to ask questions and voice any additional wishes. A. Always wash your hands upon completion of care. This is the most critical step in the infection control process that impacts the health of residents. You can never be too clean for the safety of your residents and your own health. N. Never leave without asking the resident if they need anything else. The last step before you leave is to again check with the resident and see if they have any other needs or concerns before you leave. Often residents think of things as the process goes on and have one last request before you leave. D. Document the procedure and report any findings to the staff in charge. Remember the saying, it's not what you do, but how you do it. Or did you ever hear, anything worth doing is worth doing right? Care for your resident considering both the quality of your caregiving and the quality of your resident's life. The themes will be your guide for performing all skills beginning to end. They will help you always give quality care. Imagine you are your resident with a chronic disease. Every day can be a challenge. In some cases, the only person they can count on is you, and the hope that you will care.